Public health is in trouble. That is a direct quote from one of the 4 high-ranking officials who resigned this week from the Centers for Disease Control and Prevention in protest of the White House's abrupt firing of CDC Director Susan Menariz. This was the scene outside the CDC Atlanta headquarters on Thursday. Hundreds of staff members and leaders staged a walkout, many of them hugging and clapping in solidarity with those resigning. The New York Times reports the ousting comes after Menariz and Health Secretary Robert F. Kennedy Jr. clashed over vaccine policy. She's refusing to step down as CDC director. Now, America's National Public Health Agency is now in a free fall. Here's how some of the officials who resigned laid out the stakes.
Yeah, I've been at CDC for over 30 years. And doing lots of different infectious disease outbreaks, et cetera. I've been through a lot of administrations, including the first Trump administration. This is different. The character right now is one of questioning, of a lack of respect for the science.
I'm a doctor, so I see patients. I'm a clinician. And when I was in medical school and I finished, we raised our hands and made that Hippocratic oath that said first to do no harm. And I'm seeing CDC being transformed into a weapon.
CDC is in trouble. Public health is in trouble. We need people to pay attention. We're not going to be prepared for another outbreak should it happen. We can't prevent chronic diseases in communities because we don't have the resources anymore.
Joining us now, former CDC director and former New York City Health Commissioner, Dr. Tom Frieden. He is the author of The Formula for Better Health, How to Save Millions of Lives, including your own. Dr. Frieden, it's great to have you on the show. And I was wondering if we can just start out by you underscoring for us the moment that we find ourselves. We just heard from these 4 former officials of what the CDC is. There is this narrative that has been created by MAGA and, the RFK Juniors of the world, the MAHA movement, that the CDC somehow represents powerful businesses that are not looking out for the real health of Americans because he wants people to do more push-ups and not have access to vaccines. But underscore what happens now when we see what is taking place at the CDC.
This is unprecedented. Nothing like this has ever happened before. We have 80 years of the country's health protection agency, people who work 24/7 to protect Americans from threats. And now what we see is that infrastructure really being badly damaged, badly injured. And you can see it when it comes to vaccine policy, chronic disease, preparedness, environmental health. In all of these areas, we see fact versus fiction. We see health versus sickness. That's what's at stake. What we hear from Secretary Kennedy is a series of fictions that are harmful. Fictions about vaccines, fictions about chronic disease, and fictions about the environment. If you get down to what's really happening, they've dismantled the tobacco control program, the leading cause of preventable illness in the U.S. They're undermining our vaccine infrastructure. And if you just look at environmental threats, they rolled back the rules on PFAS, forever chemicals, which are in half of Americans' water.
Dr. Frieden, Senator Bill Cassidy, he said that he had assurances from RFK on vaccines, and I wanted to play some of that footage from his confirmation hearing.
Now, Mr. Kennedy and the administration reached out seeking to reassure me regarding their commitment to protecting the public health benefit of vaccination. These commitments and my expectation that we can have a great working relationship to make America healthy again is the basis of my support. He will be the secretary, but I believe he will also be a partner in working for this end.
Now, RFK Jr. has ended critical mRNA research. The guidelines are so confusing for the average American to navigate, whether it's for themselves, for their child, for their elderly parents. There's complete disarray among America's vaccine policy right now. Where should Americans be going to get unbiased, medically accurate information about their health?
I never thought I would see the day when you couldn't trust what's on the CDC website, but that day has come. And the result is that you need to talk to your doctor. You need to check with groups like the American College of Obstetricians and Gynecologists, the American Academy of Pediatrics. The U.S. has had 60 years of success in vaccine policy, preventing hundreds of millions of illnesses. And in 6 months, Secretary Kennedy has undermined that success. What does this mean for the average American? Well, today and in the coming months, if you're a healthy young adult or a pregnant woman and you want to get a vaccine against COVID because it's proven to protect you from serious illness and reduce your risk of long COVID, you may be out of luck. Your pharmacy may be scared to carry it. Your doctor may be scared to give it to you. Your insurer may decide not to give it you. And that is just the beginning, because by turning upside down the Advisory Committee for Immunization Practices, there's a real chance that half of the kids in this country, half, rely on what's called the Vaccines for Children program. That only covers vaccines that this committee, the ACIP, recommends.
Dr. Frieden, Bernie Sanders wrote a piece today in the New York Times that said that RFK Jr. should resign. Do you think that Leader Jeffries, do you think that Minority Leader Jeffries, do you think that Chuck Schumer, do you think that these people should come out and say that? And furthermore, don't you think that Congress, even though Democrats don't have the majority, should start impeachment proceedings against RFK Jr.? At this point, we now know what his agenda is. There is no mistaking what's happening here. Do you think this is the moment for Democrats to really try and lead?
I'm a doctor, not a politician. What I can say is that every day Secretary Kennedy remains secretary, Americans get less safe. Our health protections continue to get eroded. There is a great goal of making Americans healthier. That's what CDC lives for. But the actual actions are doing just the opposite. They're spreading misinformation. They're denying people access to both information and services. And they're distracting from the most important measures that we need to implement to keep America healthy and make America healthier.
Dr. Tom Frieden, thank you.